Welcome to STEM Talk.
STEM Talk.
STEM Talk.
STEM Talk.
STEM Talk. STEM Talk.
Welcome to STEM Talk, where we introduce you to fascinating people who passionately inhabit the scientific and technical frontiers of our society.
Hi, I'm your host, Don Carnegas, and joining me to introduce today's podcast is the man behind the curtain, Dr. Ken Ford, IHMC's founder and Chief Executive Officer Emeritus, who is also the chairman of the Double Secret Selection Committee that selects all the guests who appear on STEM Talk.
Hi, Don. Great to be here.
So today we have Dr. Scott Sherr, Director of Integrative Hyperbaric Medicine and Health Optimization at Hyperbaric Medical Solutions, which is an independent hyperbaric oxygen therapy provider that aims to educate people about the benefits of hyperbaric oxygen therapy via telemedicine consulting. He is also the COO of Troscriptions, which provides physician-formulated products, including popular methylene blue products. So Scott is a board-certified internal medicine physician and a specialist in hyperbaric oxygen therapy, also known as HBOT. We'll be talking about that more in the podcast. And HBOT is approved by the US FDA to treat a wide range of disorders and diseases, which again, we'll talk about later in the podcast.
Before we jump into our conversation with Scott, we have a little bit of housekeeping. First, a big thank you to everyone who has subscribed to STEM Talk, and an extra thanks to all of you who have left those wonderful 5-star reviews. If you're new to the show and you like what you hear, please consider subscribing. And if you enjoyed today's episode, we'd love for you to take a moment to rate the show, and maybe even leave us a review. It really helps us reach more people who might enjoy STEM Talk.
As always, the Double Secret Selection Committee has been hard at work, scouring iTunes and other podcast apps for the sharpest, funniest, and most lavishly praise-filled reviews to share on STEM Talk. If yours makes the cut and you hear it on the show, please send us a note at stemtalk@ihmc.us to claim your very own official STEM Talk t-shirt, proof that the committee does, in fact, exist.
Today, our winning review comes from someone with a moniker that I suspect many of our listeners will be able to relate to. Tired Grad Student 5. The review reads, "Despite studying physiology, I think each niche of science is equally as captivating and provides perspectives to be knitted together, whether it's unique or bizarre. The most recent talk, though, ultimately opposing many of the current views in environmental discussions, provides an excellent challenge for research to search for new avenues to innovate. Except instead of learning to climb a mountain, research might start with calibrating a pipette."
Well, that is very profound and totally gets you, Tired Grad Student. So thank you, Tired Grad Student 5. And thanks to all of our other STEM Talk listeners who have helped STEM Talk become such a great success.
Okay, and now on to today's interview with Dr. Scott Sherr.
STEM Talk.
STEM Talk.
STEM Talk.
STEM Talk. STEM Talk.
Hi, welcome to STEM Talk. I'm your host, Don Carnegas, and joining us today is Dr. Scott Sherr. Scott, welcome to the podcast.
Thanks for having me, Don. It's great to be here.
And also joining us is Ken Ford.
Hello, Don, and hello, Scott.
Hey, Ken. Thanks for having me, too.
So, Scott, just to start off, I understand that you were, and this is a quote here, adjusted when you were only 5 minutes old. So do you want to tell us the story behind this?
Well, my father is a chiropractor for 45 plus years. At that point, he was a baby chiropractor when I was coming out as a baby. And he likes to say that he adjusted me within the first 5 minutes of being born, to the chagrin of the OBGYN who delivered me.
I can imagine. What kind of adjustment did you get?
Oh, good question. So when you look at, how chiropractors adjust babies, it's very small movements, of course, but it was probably something to my neck coming out of the birth canal kind of deal, I would imagine. I don't remember, honestly.
Of course not.
So, Scott, you grew up in Northport, New York, which is on Long Island, about an hour and a half east of New York City. And as a child, you spent a lot of time in your father's chiropractic office, which you were just addressing even from 5 minutes old.
Yes.
So he not only worked on people's spines and musculoskeletal issues, but you also observed him doing other things to people. And I hear you sometimes refer to your father as a really crazy guy. Is that right?
Well, I especially thought he was crazy when I was a kid, growing up in his office, and because he wasn't like your normal chiropractor. He was a chiropractor that didn't just adjust spines and necks, but he was actually changing people's diets and changing their lifestyle and working on stress. And basically, I think of chiropractors back then in the early 80s and likely before that as kind of the OG functional integrative medicine kinds of docs. They were kind of doing everything. And that's what I saw growing up in his practice, which was really fun.
That must have been interesting. And I do remember those days, and chiropractors did indeed seem, many of them at least, as you described.
Yeah, and he had a very different philosophy than a lot of other people at the time. I mean, he was talking about organic things and not being on dairy, which is pretty unusual for the early 80s. And I remember seeing a couple early patients of his when I was a little bit older, maybe 12, 13 years old, where he'd take them off of dairy and their allergies and asthma and their pain would go away. So I started seeing these things very early when I was a kid.
Speaking of when you were a kid, what were you like as a kid? I understand that you were into sports. Could you tell us about that?
Sure. So I think I was a pretty happy kid. I have a younger brother. We did a lot of sports together. I played soccer, baseball, basketball, like the usual kinds of things. Played soccer until I finished high school. I had these sort of inclinations. Maybe I would go to a D3 school, but I realized that I wanted to go to like a bigger school for college than maybe going to a D3 for soccer. But I also picked up the guitar when I was about 12 or 13 years old. And that's really what got through me a lot of the rest of my schooling, even both at undergrad and in medical school as well.
So guitar was your primary other interest, apart from academics and from sports?
Yeah, guitar and music. I remember being in the basement of a friend of mine's house listening to a Led Zeppelin album. And of course, Led Zeppelin's much older than I am, but it was just kind of this eureka moment of what the guitar could be. Although I focused mostly on acoustic guitar, I had a lot of acoustic guitar heroes at the time, and a lot of bands were coming out like in the grunge scene back in the 1990s as well when I grew up. So that was a big component of my musical interest as well, and what I used to play on the guitar.
Jimmy Page induced many moments of awe in a wide range of ages and people.
Bring It On Home was the song, if anybody knows. It's
I do know the song.
Great song,
yes.
Yeah.
You've got a number of music aficionados here on the podcast from top to bottom. So Scott, after high school, you left New York for the West Coast and Los Angeles. So what led you to travel across the country to attend UCLA?
I decided to go to UCLA because actually my mother grew up in Los Angeles. And so when I was about 16 or 17, she took me on a trip from New York to LA. We went to UCLA. We went up the Pacific Coast Highway, went up to San Francisco. And I was out there. I'm like, why would I not go to school out here? So when I got into UCLA, it was a no-brainer. I was like, I'm going across the country. And I really didn't have any idea what I was getting into, to be honest. I had no idea that UCLA at the time was about 95% in-state. I thought it was going to be this amazing sort of melting pot from all over the world, but it was everybody that was 50 miles around UCLA. Yeah. And so they'd go home on the weekends. And I was like, where is everybody? This is kind of interesting. So, but I did have a great time. I did have a great time there overall.
Yeah. So when you set foot on campus, you enrolled as a biology major, but not too long after that, you changed your mind. So why is that? And what did you change to?
Yeah, the thing about UCLA was if you were going to be a biology major, you have to do like marine biology and other types of non-human biology. And so what I really thought I wanted to do when I got to college was go to medical school. So I was like, well, I'll take the medical school prereqs, and then I'll also find something that I really love, which was actually a history major. So I decided to change my major to history. When I realized that I would be graduating in 2.5 years if I did that, I decided to pick up another major called psychobiology, which is kind of the biological basis of psychological sciences. So I ended up double majoring in both history and psychobiology.
So then you left UCLA for the University of Maryland to attend medical school. So why Maryland?
Well, I was ready to go back to the East Coast after being in LA. I didn't so much like Los Angeles as much as I liked California, which would come back a little bit later in my career, and we can get there later. But I decided to go back, and University of Maryland was a really cool location. Baltimore at the time, this is around 2003, was really starting to become a different and really cool city. It had lots of really nice neighborhoods. I loved the program, and I really loved the medical director and the program director when I went down to the University of Maryland. So that's why I decided to head over there. And it was just close enough to New York to be a plane ride away, but not so close that I could drive home very easily. And I kind of wanted that situation. So
yeah, that's a good balance. And it ended up being a very wise decision because we understand that you met your wife at Maryland.
I did, yeah. So my wife is also a physician. She's a doc as well. She did medical school at the University of Maryland as well. She was actually a year ahead of me. She ended up taking a year off and doing some work in Ghana in Africa. And so we, as a result of that, ended up graduating together and then both going to the University of Maryland for residency as well.
So you talked about your love for playing guitar, and at Maryland, you met 3 other medical students who were musicians, and then you guys formed a band called the Airport Rocking Chairs, which I love that name. And we understand that 3 of you, as well as the drummer that you picked up who wasn't in medical school, played at gigs around the Baltimore, D.C. area at the time. So the Airport Rocking Chairs must have been pretty good, are we right?
Well, we did put out an album, but we did it, ourselves. We didn't have anybody we weren't on a record label or anything like that. But we had a lot of fun. It was really, for me, the guitar has always been a great outlet. It was a way that brought me outside of the heavy workload of being in college and especially in medical school. It was actually interesting. There was an auditorium at our medical school that was kind of run down at the time, and they've actually made it very nice at this point now. But at the time, it was run down. And so what we were able to do, because we knew all the people that ran all the AV and all the other audio video stuff at University of Maryland, we stored all of our stuff in a locker or basically a closet at this location in this auditorium. And then weekly at least, we'd go to the auditorium and we would just play as loud as we want for as long as we wanted, and nobody bothered us, which was amazing. And then we'd do gigs around Baltimore and DC. We mostly played for free food, to be honest, but we did get some money sometimes, and that's what kind of we rolled in to making an album. But yeah, it was really a lot of fun, and it was a great experience to be in a band and doing that for a little while.
So when you entered medical school, you had a high-minded idea that you could bridge the gap, so to speak, between the world of conventional medicine, about which at that point you still knew very little, and the world of alternative and chiropractic medicine, which you sort of grew up with that all around you. Can you talk about this ambitious idea you had and how that led you to medical school and sort of shaped you in some ways?
Sure. So really, as a kid growing up in my dad's office, I always loved the work that he did. And I really gravitated towards the sciences. Obviously, that's why I went to medical school. But it wasn't initially what I thought I was going to do. Actually, it was probably end of high school, early college. I was deciding if I wanted to go to a professional school. And I was thinking about chiropractic and had a conversation with my father. I remember, I must have been around 18 or 19 years old. And the idea at the time was like, well, maybe medical school is the right route, because if you get the medical school education and you already know a lot of the alternative base from growing up in the office, then you can kind of figure out what you want to do and maybe do something really cool. And that really resonated with me. And the idea was, well, I had this high-minded idea, as you mentioned, to be able to bridge this gap between conventional medicine, which I knew very little about, honestly, at that time, and the alternative world. And so in medical school, my goal, after getting through the first couple of years of really hard study, was to kind of figure out what that road was going to be. And it was not an easy task to understand it right away. Definitely, getting tantalized by all the professions of getting to be a gastroenterologist or radiologist or whatever that make a lot of money initially out of the gate, but I always came back to the idea of trying to bridge that gap.
That is interesting, and I think it uniquely connected your childhood and your relationship with your father to your future. I think that's very interesting. In your third year of medical school, you were doing rotations, as I understand it, at the University Shock and Trauma Facility. And in Baltimore, one can easily imagine why that would be a large one, and one of the largest. This ended up being an important experience for you. Could you tell us about this? I understand that this was an important turning point for you.
Yes. And so as a third-year medical student at the University of Maryland, you do a 3-week rotation, at least you did when I was there, in shock trauma, which is one of the largest shock and trauma centers in the world. And all the military branches actually train there too, because of all the shock and trauma, the gunshot wounds, the stabbings, and things like that. It's a pretty interesting place to be. And what's also at the time was very challenging was that you're on call, what's called Q3. So Q3 means that every 3 nights you were on call for 30 hours. And so you'd stay up for 30 hours, you'd sleep for 4 hours, you'd go to bed after having dinner, and you'd do it all again. Basically, you'd have 2 regular days, and then you'd have another 30-hour shift. So it was pretty gnarly, and you got to see a lot of crazy things as a result of being there so much. But in the basement of the facility was a very large hyperbaric chamber, and that really changed my trajectory a lot.
Wow.
So there's something about having those hyperbaric facilities in the basement of facilities, because it's the same thing at Duke University, which is where I
Yes,
studied. Just as
that's
an
where they are.
aside. Yeah. And hyperbaric chambers are used for things like necrotizing fasciitis and other severe wounds. And I understand this is where you first became fascinated with the potential for hyperbaric oxygen therapy. Is that correct?
Exactly. I remember the first patient that I saw. It was a lady with severe necrotizing fasciitis, which is also known as flesh-eating bacteria. And her limbs looked terrible. Like they were black and dusky. And I saw her initially come to the trauma bay in the ER where they would come. And then she left and I didn't know where she went. And then like several hours later, I was still there because it was probably one of my 30-hour days. And she came back into the trauma bay and she looked entirely different. Her legs and her arms were all pink. There was some black and she eventually did need to get a little bit of an amputation. But when she initially came in, it looked like she was going to have to get amputated all 4 limbs. And it was just kind of shocking to look at what happened to her. And I asked the attending at the time, he's like, oh yeah, she just went down to the hyperbaric chamber down in the basement. I'm like, the what? And that's when I first started understanding the power of this. I saw a number of people at the facility at Shock Trauma with severe trauma, with wounds, necrotizing fasciitis, and I was just kind of floored with the potential of this therapy to help these kinds of people. And it really piqued my interest enough that when I was a little bit less sleep deprived, a couple of weeks later, I started really digging into the science.
So, as you started to do more research on hyperbaric medicine, you came to an important realization that this technology was really being underutilized in conventional medicine. Is that correct?
Sure, yes, in conventional, and there was so many other ways that it could be used. That was the main thing that really kind of spurred me, Don. It was the fact that we had 14 indications to use hyperbaric therapy in the US, and even for those, it was being vastly underutilized. And then across the world, it was being used in some countries for 60 or 70 indications all at the same time. And so I really decided that this was a technology, especially because of how simple the physiology was and how profound the changes were, that this is really something that I wanted to get into more.
That's awesome. So, Scott, on that note, this is probably a good time to give our listeners a brief primer on hyperbaric oxygen therapy, which is sometimes referred to as HBOT. You may see that in the literature. So, I suspect most listeners are familiar with how divers who suffer from decompression sickness are placed in hyperbaric oxygen chambers or then treated for decompression sickness. But can you share the mechanisms of hyperbaric oxygen therapy and how it could benefit the body under other and the right circumstances?
What I loved about this technology, Dawn, is how simple it was. And that's what really got me excited about it. It's just a combination of increased inspired oxygen and increased atmospheric pressure. And so let's deal with oxygen really quickly first. Oxygen is kind of a big deal. I think most of your listeners know this. Oxygen is what's called the final electron acceptor in the mitochondria to help you make ATP, your energy. If you don't have a lot of oxygen around, well, you don't live for a long period of time, right? So in a chamber, what we can do is we can actually increase the amount of oxygen from the normal amount, which is about 21% in the air at sea level, to up to 100% if we want. Now, oxygen carrying capacity is relegated to how many red blood cells you have in circulation. Red blood cells carry oxygen from our lungs to the rest of our body to maintain the capacity to make energy. So if you want to increase the amount of oxygen in circulation, it's actually not that easy to do without pressure. And this is why, right? Because you have these red blood cells that are almost fully saturated with oxygen when they leave the lungs. So if anybody has put on a pulse oximeter, which I'm sure everybody has since COVID or before it, you typically have, if you have normal lungs, it typically ranges between 96 and 100%. And what that is giving you an indication of is how many sites on those red blood cells are bound with oxygen. And the molecule that binds the oxygen, by the way, is called hemoglobin. Okay. And so if you want to increase your oxygen carrying capacity, well, what you can do is you can give yourself a blood transfusion, because you can then as a result of that, you have new red blood cells that can carry more oxygen. You can also take the doping drug called Epogen, which is going to increase the number of red blood cells you have in circulation. And also, you can come to Colorado, where I live, and come altitude training and naturally increase that hormone. Okay. But so the other way, though, to increase oxygen in circulation is by increasing the atmospheric pressure. And that's the other aspect of hyperbaric therapy. We simulate the pressure you feel under a certain amount of seawater. Water is heavy. If you pick up a bucket of water, everybody knows that's pretty heavy, maybe not for Ken, but for me. And so you have this bucket of water, its heaviness. Now you're under 20 feet of water. That's extremely heavy. And that pressure itself from that heaviness of the water drives oxygen circulation using a physics law called Henry's law, which described that the more pressure you put on a gas, the more of that gas is going to go from a gaseous form to a liquid form. So In essence, you have increased inspired oxygen combined with increased atmospheric pressure, driving huge amounts more oxygen in circulation than you can do without the pressure itself.
That was a clear description. One often hears a description of the mechanics of HBOT therapy, and it's usually not as well said and as clear as that. So thank you.
It's taken me 20 years to get it right, Ken, so I think I got it now.
It was clear. One reason that there's so much interest in hyperbaric oxygen therapy is really, as you mentioned earlier, it's been shown to help in many, many conditions. You mentioned, I think, 14 and many more overseas. And some of them that I've seen mentioned in the context of traumatic brain injury and chronic pain, ulcerative colitis, and probably of interest to some of our male listeners, erectile dysfunction. Could you talk about other conditions, some acute and perhaps long-term or chronic conditions, where this could be helpful with respect to a treatment to mitigate the condition?
Yeah, sure. So what it comes down to is that when I was learning about hyperbaric therapy in shock trauma when I was in medical school, my father, who's the chiropractor, was also learning about it from the alternative side, looking at it for autistic kids specifically. And he was noticing that using these chambers in some circumstances was significantly helpful. And that really kind of spurred my interest in understanding, wow, there are many things that we could potentially be using hyperbaric therapy for that we're just not doing it in the United States. And at the time, it was a pretty nascent world of outside of the hospital hyperbaric oxygen therapy. And that means that you have the capacity to use these chambers outside of the hospital world. But it was starting to grow. And I was looking at some of these facilities out in the world that are doing this and then seeing that what they're doing with traumatic brain injury and chronic pain, as you mentioned. And I was really actually quite floored with the research that was happening outside the United States, especially in Israel. And actually in Israel in 2018, I went to Tel Aviv and I met with some of the premier researchers there. And that's when I saw some amazing things happening in the world of hyperbaric research. And it was actually quite interesting. Their main researcher, his name is Dr. Sherr. Sherr is a really amazing guy. He showed me some pictures of what I didn't know what it was on the screen. He's like, look at this and look at this before and look at this after. And it was a tube. And he told me afterwards, he's like, well, what do you think it is? I'm like, well, I don't know. What is that? And he's like, it's a penis. And he showed me pictures of an MRI, a functional MRI scan before and after hyperbaric therapy, which showed blood flow to the penis before and after. And he told me this is what he showed all the men that came to the clinic in Israel, and they all signed up for hyperbaric therapy afterwards. So but when you talk about long-term what hyperbaric therapy can be used for, and both from acute and long-term perspective, if really what it comes down to, and we can talk more about this later too, is that if you have an acute wound or if you have acute inflammation, hyperbaric therapy is one of the best technologies out there to heal this in a very, very fast way, because it just revs up your capacity to heal. It decreases inflammation, it decreases swelling, it releases stem cells, it optimizes your immune system, it helps with lymphatic flow. So all these things are really important on the acute side. When it's more of a long-term condition for hyperbaric therapy, for example, you have a mild cognitive impairment, or you have a chronic pain condition, or you have like a performance-related goal in the future, like in those cases, hyperbaric therapy can be fantastically beneficial too, but it's usually more hyperbaric therapy that's needed. And typically also, which was very, very important for me, is creating a foundation of health, or at least trying to acknowledge that that's a big component of optimizing long-term health too.
So this is fantastic, Scott. We will circle back around to talk more about hyperbaric oxygen therapy a little bit later in this discussion. But first, I wanted to ask you about what happened after your residency at Maryland. So you stayed in the Baltimore area and became a hospitalist, which is an internal medicine physician who acts, like a primary care physician inside a hospital. And for the next 15 years, you treated thousands of hospital patients that suffered from a wide range of conditions. So can you talk to us about how this period of time gave you, a pretty unique understanding of the strengths and limitations of modern medicine?
Sure. Well, acute care medicine in the United States is quite good. It's actually fantastic. And critical care trauma medicine, my goodness, it is amazing what we can do to keep people alive. There's a difference, though, from being alive and actually thriving and actually having what we call healthspan, which is a number of years on this planet as healthy as possible, because we know that healthspan is going down dramatically. And I would see that day in and day out as a hospital physician. Hospitalists have been around since the late 1990s, when primary care doctors got too busy to go both to the hospital and see their patients in clinic. primary care doctors. Some of them decided to become hospital focused and became your primary care physician in the hospital. So like your quarterback, if you have a GI bleed, for example, you would have a hospitalist, but you'd also have a GI doctor seeing you and maybe doing a colonoscopy or something like that. So it was a really challenging experience, I would say, Dawn, because hospital medicine can kind of wear you down. Maybe not as much as ER medicine. Most ER docs will burn out between their early 50s typically, because it's just a lot of things just being thrown at you on a regular basis. But it really gave me a nice, I think, experience in the sense of what acute care medicine really can do. But it also made it very clear to me that there's only so much that acute care medicine can do, and that the system, really the conventional system from a primary care perspective, was absolutely broken. And at the very least, what I saw, or at the most, what I saw was that it could help on the acute side, but really just putting Band-Aids on things and just seeing people come in and out of the hospital over and over again was pretty challenging over the time. But I really did enjoy my experience, and I had some great places where I worked in Redwood City in California at a place called Sequoia Hospital, and I was in Colorado for a while as well at the ends of my hospitalist career, and I really did enjoy my time. And the people, the docs that I work with are always fantastic.
So based on your experience you just described as a hospitalist, that would seem to have been foundational in your understanding of medicine, and in particular of patient care and, as you said, healthspan. Could you elaborate on this a little?
Sure. So I learned a lot about working with patients in the hospital. There's no doubt about it. But underneath all of this, or as I was working as a hospitalist, I was also building my integrative hyperbaric practice. And so it really became a very sort of stark contrast to me on some levels, working in the hospital, maybe 16 or 17 shifts a month, and then going into my own clinical practice with hyperbaric medicine. But it really was helpful for me to be in both places, actually, because it really gave me a great understanding of the limitations on both ends, and that it wasn't a zero-sum game. And going back to my dad for a minute, when I was a kid, like when I was very young, he was militantly against anybody going to conventional doctors for anything, actually, back in the 80s. But as he got older and more experienced, he realized that there's a place for all of this. And I think that's what's so important. It's not like anything's mutually exclusive here. And that really became I became very aware of that as I was kind of reaching the ends of my hospitalist career, increasing my practice outside the hospital, still very much acknowledging that was a huge part of what I did. And it really gave me the flexibility to raise a family. I had 4 kids in my 30s, which was fun, mostly for my wife, but I was also involved. And at the same time, I was being a hospitalist, I was creating my own integrative hyperbaric practice. And so I have a really significant respect, and I really enjoyed that time, even though it was a challenge.
So, Scott, because your wife received a fellowship at Stanford University, you moved back to California, as we've been talking about, and you continued your work as a hospitalist, but you also became a medical director of a hyperbaric medicine facility in the San Francisco Bay Area. So can you tell us about how this role deepened your appreciation and your expertise in hyperbaric oxygen therapy?
I was very excited about this medical directorship role because I always knew, as I mentioned, that I didn't want to just be a hospitalist. I always wanted to find a way through to create this way through this gap, this chasm between alternative and conventional medicine. And surprise for the listening audience that it was hyperbaric oxygen therapy, because it was hyperbaric therapy that had this capacity to be used conventionally and being vastly underutilized. And at the same time, had this significant capacity to help people outside of that conventional box with all these different conditions that were not being treated well in the conventional world. And so when I got this opportunity to be the medical director, about 6 months into our move to California, I was extremely excited. And I got to actually train with a nurse that was formerly an ICU trained nurse who was the person who ran this facility, and she'd been running it for the last 2 or 3 years. And I learned a huge amount about hyperbaric therapy very, very quickly, about things like Lyme disease and chronic infection in general, how to integrate other things with hyperbaric therapy, which became very, very important to me as I learned more about hyperbaric medicine and some of its limitations. I also learned about how you could treat strokes and traumatic brain injuries. And this is when I first started talking to other people in our networks as well that you both know.
Absolutely. It was during this time, I think, when you met our friend, Dominic D'Agostino, who is an associate professor at the University of South Florida and also a colleague here at IHMC. Actually, Dom was our guest just recently on STEM Talk episode 196, where we talked quite a bit about some of his thoughts and insights regarding hyperbaric oxygen therapy, as well as the University of South Florida trial that he's supporting on hyperbaric oxygen therapy for traumatic brain injuries. You met Dom about a decade ago, as I understand it, and I can imagine some of your conversations with Don were probably rather significant as you seriously started thinking about a more integrative approach to medicine. Could you sort of tie this all together for us?
Dom had a huge impact on me, and it was because of another physician in the Bay Area. His name is Dr. Thomas Cowan, who came to my office at the Hyperbaric office in 2013. What Tom said to me was, I want to use hyperbaric therapy combined with a ketogenic diet because I want to use it for cancer. And I was like, what? What are you talking about? And then he told me about this paper that Dom had written at the time or had published at the time on the metastatic model of cancer, combining hyperbaric oxygen therapy with the ketogenic diet. And as a result of reading this paper and talking to Tom, I was connected to Dominic D'Agostino, and learning about what was happening in his lab, it became transformative. So we became really fast friends because it was very nascent in the world of hyperbaric therapy. And at the time, even trying to get somebody on a ketogenic diet was like almost impossible. There was no resources or anything. So he and I would speak a lot back and forth about the ketogenic diet and getting patients on this. And it was a huge impact on my thoughts of understanding cancer, especially, and how hyperbaric therapy could be helpful there, and starting to see some benefits using this protocol with patients in the early 2010s was actually amazing to me. And so we've obviously stayed in touch all these years later, and we still work together in various ways. And his research has been amazing and such a big part of bringing hyperbaric medicine to the world, which I super appreciate.
It's fantastic. We're all friends of Dom's here across the podcast with you, Scott.
He's
That's
the best.
fantastic. Yeah. And actually, I met Ken because of Dom. So that's how I got brought into IHMC. It was through Dom. So yeah, it's a great history. So Scott, you, while continuing your work as a hospitalist, you began to develop a more integrative approach to hyperbaric medicine that took into consideration nutritional status, sleep patterns, mitochondrial function, and a number of other factors. And you began to see that some patients required weeks or even months of preparation before beginning hyperbaric oxygen therapy, which is not the status quo at the time. So can you talk about these new insights and how the experience fundamentally changed how you viewed medicine?
What I always knew was that there was an integrative approach that was going to be necessary. I knew that the more you could do to support somebody, hopefully they have a better outcome as a result of that. And it became very clear to me early in my career as somebody involved in hyperbaric medicine that it was a fantastic technology, but if it was used at the wrong time, it may not be very good for somebody. And it actually might be slightly detrimental, at least in the short term. I was always see people recover, but it didn't have the impact that I was hoping for. And what I realized is that if you have an acute indication for hyperbaric therapy, acute trauma, acute stress, acute inflammation, hyperbaric therapy is a fantastic technology under almost any circumstance to help you heal faster. This could be from a surgical wound. This could be from a traumatic wound. This could be from an infection, like I mentioned earlier with necrotizing fasciitis. But what I was seeing time and time again, even with that nurse who was the lady that I worked with at the facility, she had chronic Lyme disease. I would see her do hyperbaric therapy, then she would relapse, and she would do another hyperbaric protocol, and then she would relapse again. And it became very evident to me that there was a base level of foundational health for people that had long-term conditions that was going to be absolutely essential. And so what I started to do was think about tools and technologies and practices and create a referral network with other doctors in the area around the Bay Area that I could send people to. I could send people to psychiatrists. I could send them to physical therapists. I could send them to functional medicine doctors and integrative physicians to do more foundational work. And when I started doing this stuff and also getting involved in the technological space, in this same period, I was getting involved in the sort of biohacking performance space. So I was looking at red lights and sauna and cold before it was cool, and also looking at other crazy technologies that were being used initially in the biohacking space and now have come out there outside of that, like pulsed electromagnetic field technologies and others. So I started to use all these things in clinical practice. And it became very, very evident to me that if you could create more of an ecosystem, a foundation for people ahead of time, then they would do so much better. And that's what I started really doing in my integrative hyperbaric practice.
So that's fantastic. And as you developed an integrative hyperbaric medicine model, you really caught the attention of HBOT practitioners, not just across the country, but also across the globe. And so while you continued your work as a hospitalist, you also increasingly began consulting with patients and physicians in HBOT facilities, again, not just here in the US, but also overseas. Can you talk about the evolution of this work?
Once I realized the power of the integrative approach in hyperbaric medicine, I knew that this was my way through, my way to bridge that chasm that I was talking about earlier. It's evolved a lot even since that initial point. But I knew at that point that I had to bring this to the world, because what I saw happening in hyperbaric clinics was that people were not getting people were not having the outcomes that we would anticipate all the time. And I wondered why. And that's why I decided to kind of have this approach and create this over time. And so what I wanted to start doing was talking about it. And so I started initially on podcasts, then I started doing lectures about this. And then I started teaching other hyperbaric facilities around the world how to start using hyperbaric therapy in a more integrated way. And this became really, really important because as I started talking about it more in an integrative way, I was also getting pushback from the hyperbaric community. And this is probably not surprising to you. When you have a hyperbaric facility and you want to have patients to go into your hyperbaric chambers, well, you want them to go into your chambers if they come through your door. And all of a sudden, I'm telling you, you know what? Maybe you should wait 3 or 6 months to put somebody into chamber, because that's going to be better for them from a more optimal perspective. And that's got me a little bit less fanfare in the hyperbaric community over the years sometimes. And it kind of culminated, and I was supposed to give a lecture during the pandemic on hyperbaric therapy. The title of my lecture was going to be, "Please do not put them in the chamber." And mind you, this is to a hyperbaric audience. And so I got disinvited from speaking at that particular lecture. So that was okay with me, because I knew that by doing what I was doing, I was really trying to create an educational framework around hyperbaric therapy that was much bigger than the technology itself. And that's what I truly cared about.
That's wonderful. And back when you were in medical school and discovered hyperbaric oxygen chamber in the basement of the shock and trauma facility, at that time, it wasn't very well known at all. And this has certainly changed in the past 20 years, especially in the last 5 or 10 years. A particularly promising application is its use as a complementary treatment for autoimmune diseases. It has been shown to reduce inflammation, improve blood flow, not surprisingly, I guess, and support immune function. Could you tell us more about this? There's a lot of interest these days in autoimmune diseases, and STEM Talk gets a good bit of mail from our listeners, and some of the questions ask about autoimmune, in fact. So this is a question that's very relevant to the listeners.
Awesome. I love it. So what it comes down to here is maybe it's a quick recalibration of hyperbaric physiology. We talked about how we flooded the body with a huge amount more oxygen in the beginning. And now what does the body do with all that oxygen? Well, that's the power of getting that much oxygen circulation. What we have is a shift in how your body's physiology works in a very significant way. So acutely, immediately when hyperbaric therapy brings all that oxygen circulation, you get decreased inflammation, you get decreased swelling, you have increased capacity to get oxygen to tissue that might be at risk for dying. And that's why it's so amazing for an acute issue like an acute heart attack, stroke, traumatic brain injury, spinal cord injury. There's good data showing that hyperbaric therapy, when used immediately or as quickly as you can after one of these acute episodes, can save tissue in your brain, in your heart, in your spinal cord, and things like that. So that's a huge issue and a huge thing. In addition, on the acute side, you have an acute upregulation of your immune system, as well as blood flow and detoxification. So that's immediately what's happening in the chamber. Now, over a period of time in a protocol of hyperbaric therapy, meaning you're going into the chamber not just once, but you're going in maybe 5, 10, 20, 40, maybe sometimes up to 60 times, 5 days a week. What's happening is you're shifting what's called the epigenetic expression of your DNA. Your epigenetic expression changes how your DNA is transcribing proteins. And what this does, it shifts your DNA to transcribe proteins that are responsible for growth and repair. So you get more blood vessels. Those stem cells that were released with the acute hyperbaric exposure now start maturing into the tissues that they need to mature into. Initially, you had a decreased inflammation. Now you have a downregulation of inflammatory markers like interleukin 6 and 12 and TNF alpha. And so when you're thinking about a long-term condition like an autoimmune disease, what you're really seeing there is that you have somebody that has a long-term issue with their capacity to maintain or to regulate inflammation. And what hyperbaric therapy can do over a longer period of time, over a protocol, is downregulate some of those pathways that are very much responsible for the inflammatory cascades that are ongoing, very much responsible for the symptoms of autoimmune conditions. And I remember very early on, maybe a year into working at the hyperbaric facility in San Francisco, there's a lady that came in with rheumatoid arthritis. And she was young. She was actually very young. She was in her 20s at the time, which is very young to be diagnosed. And this is not a juvenile type. This is something that she developed in her 20s. And we did a period of 40 hyperbaric sessions, 40, at a deeper pressure in the chamber, which is about 2.4 atmospheres. And she had remarkable improvements in her symptomatology. Now, but this is the kicker though, Ken, is that 3 months later, her symptoms started to come back. And so we had to use hyperbaric therapy chronically for her to maintain a symptom benefit. And what also seemed to be really important for this particular lady is that once she started optimizing her foundational biology, changing her diet, her lifestyle, optimizing her vitamins, minerals, and nutrients, looking at things more in a comprehensive way, then her symptoms started to remain significantly better, needing less hyperbaric therapy over time.
You mentioned epigenetic changes. Have people directly measured that, and how long are the changes sustained after a treatment?
So epigenetic changes have been measured, and they've been measured to start happening within just a couple hours after or even during a hyperbaric session. So they start happening very, very quickly. But the solidification of those epigenetic changes, the capacity to maintain your healing journey so that now you have new blood vessels that are growing, for example, that happens after about 20 or so hyperbaric sessions. That's what's mostly been studied. After about 20 sessions, 5 days a week, with the weekends off typically, that's when you start seeing those epigenetic changes solidify into actual real physiologic and sustainable change in tissue. Now, it could be a little bit longer for some people, depending on where their injury was and what their injury or what their issue is. Like, for example, if it's a radiation injury, so we use hyperbaric therapy for people that have had radiation injury, not for acute radiation from cancer, for example, or for a cancer treatment, but long-term radiation injury. So they've had a wound in a radiated bed, and you want to do hyperbaric therapy. It is one of the best technologies for radiation injury. However, it's not something that immediately will work. It takes at least 30 or 40 sessions to regrow blood vessels in a tissue bed that's been radiated, because radiation destroys vascularization. It destroys your stem cell supply in that area. And hyperbaric therapy, what it really can do, and this is what I tell patients all the time, is it rebuilds your scaffolding, rebuilds the scaffolding of the tissue. So you get more connective tissue, you get the stem cells that are laying things down, you get new blood vessels in the tissue. So it really does take longer to see that kind of benefit. And that's what we typically think of like a longer hyperbaric protocol, 5 days a week, for at least 20 sessions to maintain epigenetic changes. If you're doing it less than that, it's usually more of an acute benefit that may not be long-term as beneficial if you're looking for more long-term gains. That's when longer hyperbaric protocols may be helpful here, because you really want to get that sustainable change that you'll be able to maintain after getting out of the chamber.
So, Scott, this is a little bit of a different angle, but what about HBOT as a game changer for some athletes who are looking to accelerate recovery times from injury?
When it comes to athletes, this is obviously a huge piece of the hyperbaric puzzle for people. This is where many of you that are listening have heard of hyperbaric therapy from people like LeBron James and Djokovic, the tennis player, who've been using hyperbaric therapy for long, long periods of time. In fact, Djokovic is the most famous probably because he travels all around the world and makes sure that he has a hyperbaric facility to go to everywhere he goes when he's playing tennis. And so why is he doing that? Well, hyperbaric therapy is a fantastic technology to heal and to decrease inflammation. And so if you're looking to recover faster from an injury, hyperbaric therapy is going to do this. And this is actually something that I realized very early on. There was a baseball player that came to the hyperbaric facility in San Francisco and had one of those Tommy John surgeries, which is a pretty involved surgery. I think the time to come back after that is about a year, if I'm not mistaken. And we were able to cut off about 5 months of his recovery using hyperbaric therapy. He was able to get back and start throwing much faster. And the literature is not subtle here. You can see 30 to 70% faster healing times from an acute injury if you do hyperbaric therapy. Now, that's a pretty big range, 30 to 70%, but it's significant. I mean, of course, if you're at the top level of your sport, you're getting paid millions of dollars a year, and you're not getting that money, or your team's not allowed to let you play because you're injured, getting you back on the field is a huge deal. But this also can matter for somebody that had an ACL tear and that just wants to get surgery to get it fixed, and then they want to heal faster. This is very important for any kind of surgical procedure, actually. And so when it comes from the athletic recovery perspective, it really extends to anybody that has an acute injury where hyperbaric therapy can be helpful. And even on the recovery side, even if you don't have an injury, hyperbaric therapy is going to maintain your capacity to heal faster too and recover faster. And we see that all the time. And that's why many athletes and many other, maybe weekend warriors as well are getting hyperbaric chambers, not only going to clinics, but also getting them from their homes as well.
That's fantastic. So before we get everyone excited about HBOT, are there some people who should avoid therapy?
Yes. Well, this is an important piece, Dawn, because there's a couple things to talk about here. The first is to understand that not all hyperbaric therapy is equal. Okay, there's different types of chambers, and there's different pressures that you can use in a chamber. People have seen these soft-sided chambers out there. There's soft hyperbaric therapy or mild hyperbaric therapy. And then there's hard chambers. There's single unit chambers, like a chamber you'd have one person in. And there's also something called the multi-place chamber, where you can have multiple people in a chamber all at the same time. Mild hyperbaric chambers use less pressure, less oxygen. Deeper pressure chambers use more oxygen and more pressure. And so when you're thinking about this, as some of you probably can imagine, the deeper you go, the more pressure, the more oxygen, the more potential that you can cause stress on the body. And what I mean by stress here is what I would call oxidative stress. And so in the end, hyperbaric therapy is flooding the body with a huge amount of more oxygen. We've talked about this. That oxygen has these catalytic changes, epigenetic changes that we've spoken about. But that oxygen, how does it actually make that happen? It's by oxidative stress, meaning that when you have a huge amount of oxygen in circulation, all of a sudden in a hyperbaric chamber, you have some of that oxygen going to make energy, making your ATP. We talked about that earlier too. But there's also a huge amount of it that's going to create an oxidative load, a huge amount of reactive oxygen species. And ROS is thought to be a bad thing. And in too much of a quantity, it absolutely can be too much of a good thing or a bad thing, or in whatever case you want to say. But some amount of oxidative stress, it can be very, very transformative if you have the capacity to neutralize that stress. If you do not have that capacity to neutralize that stress very well, this is when you are not going to feel very good, especially at deeper pressures in the chamber. And this is where people start feeling like they crash after they get out of a hyperbaric chamber. They feel tired, they feel weak, they feel GI complaints, they have headaches. This is what I started seeing in the beginning of my hyperbaric career and wondering to myself, why is this happening? Why are these people going in and feeling so terrible? And I realized it's because they couldn't tolerate the oxidative load. They couldn't tolerate going down to these deeper pressures in the chamber because it was causing too much stress on their physiology, on their mitochondria specifically, and they didn't have enough antioxidant capacity to be able to neutralize this. Actually, Dawn, you are, I think, on this paper with Dom D'Agostino, talking about how using hyperbaric therapy with the ketogenic diet specifically has these amazing benefits. And one of the things in that paper that you both talked about was the idea that it takes about 3 days for the body to kind of catch up from the oxidative load of being under hyperbaric therapy, if you have the capacity to do that. So some mild decrease in feeling awesome it's not unexpected, but having people significantly decline was where I started seeing a significant need to address that oxidative load or address the capacity, the machinery of the mitochondria to work as well as possible, so that when you brought somebody into hyperbaric chamber, that they were going to actually be able to tolerate hyperbaric therapy and actually benefit from that epigenetic change and not have significant detrimental effects because they couldn't tolerate the oxidative load.
That's fantastic. And you've talked about the integrative approach, a bit already, but to optimize HBOT, you work with people to tailor their treatment to their individual needs. And your approach involves certain protocols for people to follow before, during, and after their hyperbaric oxygen therapy sessions to maximize those benefits. So it's a pretty comprehensive approach that you've put into place. Can you walk our listeners through what your approach might look like?
Sure. And the integrative approach that I've developed for hyperbaric therapy is because I realized that there were many people that really could benefit from hyperbaric therapy, but not right now. I always like to say that it's not if hyperbaric therapy will be helpful, it is when. And if you can work on that when, then you can transform the whole capacity for somebody to heal and to get the benefits from being in a chamber. And this is not something that is easy for people to do sometimes, because in the beginning and still now, people will call me on the phone or want to consult with me. Hey, doc, I would love to use hyperbaric therapy for my elderly mother. She has mild cognitive impairment. I think that she really need to get into a chamber now. And when I tell them, well, you know what, it might be a better idea to work on foundational health principles, optimize her vitamins, minerals, nutrients, and cofactors, look at her diet, her lifestyle, and then 3 or 6 months later, let's see about hyperbaric therapy. That can be hard to hear, but it's also, I think very educationally helpful for people to know that, hyperbaric therapy is a fantastic technology for acute things. But if you look at more of an ecosystem now, what are you doing before you go into the chamber? And what are you doing during after? And so the before is probably the most important, because think about it. If you're bringing somebody into a hyperbaric chamber and you're flooding the body with a huge amount more oxygen, does your physiology have the capacity to manage that in a way that you're actually going to see benefit, not only in the short term, but the long term too? And so optimizing the machinery of energy metabolism became a huge focus of mine. And understanding that if we did this, if we gave people the capacity to make enough energy effectively and efficiently, and also to address the stress of making energy and the reactive oxygen stress as well from flooding the body with all that oxygen, they would have a huge amount more capacity to benefit from hyperbaric therapy. And then long term, they would have more sustainable effects. back in 2018, when I was in Israel and I was learning about hyperbaric therapy for longevity specifically, I asked the guys there, they were seeing some amazing effects, and they published some great studies in 2020 to this effect as well, about how hyperbaric therapy can help with brain function and cardiovascular function and erectile dysfunction as well. I asked them how long the effects lasted, and nobody knew. And nobody was looking at that. And this is something in my clinical practice that I've seen, that if you don't do those other things, you don't optimize the whole physiology and that foundation and look at it before, during, and after, as I'm describing it, those long-term benefits are not going to last. And it became a huge indicator for me that we need to have a much larger framework of thinking about hyperbaric medicine and not just the chamber itself.
That was well said.
STEM Talk is an educational service of the Florida Institute for Human and Machine Cognition, a not-for-profit research organization investigating a broad range of topics aimed at understanding and extending human cognition, locomotion, health span, resilience, and performance.
Most HBOT studies still describe dose in terms of pressure, oxygen concentration, and number of sessions. How do you define dose biologically, and what metrics tell you that a patient has received enough treatment to induce a durable change?
So I think of hyperbaric therapy as a very dynamic treatment program for people. It's not like you stay at one pressure and you just let it be there for the whole time of their protocol if they're not having the benefits that you see. This is why having a dynamic hyperbaric protocol, along with an integrative approach that I've developed with those, before, during, and after, is so important. And I mentioned the before already with the machinery, but during here is pretty interesting, right? So if you have a hyperbaric chamber and you need to do your physical therapy and you have a big enough chamber, well, you can actually do physical therapy inside of a hyperbaric chamber now, which is super cool. Even if you have a small chamber. So recently I was working with a gentleman that had a surgical injury where he actually became paralyzed during the surgery, which was kind of crazy. He was rebuilding and he was actually getting better. He could use his legs again in the hyperbaric chamber. What I had him do was actually do his occupational therapy, move his hands, move his feet specifically here to help work on getting blood flow to those areas and then retraining the brain to know that these signals need to be firing again. And so what I've seen is that you can really leverage that during hyperbaric therapy for people that have physiologic needs, or even if you're looking at it from a longevity or cognitive performance perspective, you can do fun brain games, even if you don't have anything inside the chamber with you. They may not be that fun. They can be hard. My least favorite game is subtracting 7 from 100 as long as you can and see how long you can do that. That's a very difficult one. But if you can do that, you'll be able to do it better in a hyperbaric chamber because you have more oxygen around. And actually, the Israelis actually pioneered this literature where you can have more oxygen carrying capacity. You have more brain capacity under hyperbaric conditions because you have more oxygen getting to your cells, getting to the mitochondria, the part of your cells that make energy. So you can maintain and increase capacity. So you can think about this and leverage technologies before, during, and after hyperbaric therapy because you have all this oxygen in play. And so when it comes to dose, the dose really depends on the physiology and depends on the indication. We use less hyperbaric therapy pressure, so milder pressures for more neurocognitive injuries, more neurocognitive optimization, so brain optimization. And we use deeper pressures in the chamber typically for more systemic healing, for systemic inflammation, anything out of the central nervous system. So if you have a knee injury, you're going to want to go to deeper hyperbaric pressures. If you have a brain injury, you're typically going to want to go to milder hyperbaric pressures. There is a spectrum here. The nomenclature might be helpful for people that are listening. This all comes from the diving world because that's how hyperbaric therapy got started. You have what we call atmospheres absolute of pressure. So one ATA is 0 feet of seawater and 2 ATA is 33 feet of seawater. And so typically we range pressures for people somewhere between 1.3 and 2.4 ATA as the huge spectrum. From a neurologic perspective, we usually use 1.3 to about 2.0. And from a systemic perspective, we typically use 1.8 to 2.4, 2.5. There's a range there and everybody's going to be different and you don't always want to start at those particular doses. And as far as how many sessions you need, it depends on the acuity of your issue. If you have more of an acute issue, you might need only like 3 to 5 hyperbaric sessions to see a dramatic change. But if you have a chronic issue, you might need to be there for 20, 40, 60 sessions to really get those epigenetic changes to fully flesh out and optimize. And of course, the best case scenario is that you've optimized before going into the chamber to have a foundational approach so that those epigenetic changes and those shifts become more sustainable and hopefully more permanent.
So you've treated thousands of patients, and in the course of doing that, I wonder if you could reflect on which characteristics of these patients most reliably predict a robust response to HBOT and which characteristics predict a rather minimal effect.
A couple things come to mind here. The first one is, which is interesting, if you have a patient that's coming in with a long-term condition, in the first week or so, if they have a massive improvement in how they feel, that is a huge indicator that a full hyperbaric protocol for their long-term condition is going to be extremely beneficial. However, if they do not have a massive benefit in the first 5 days or 5 treatments, it doesn't mean they still won't benefit. So it's not a negative predictor, but it's an extreme positive predictor if they have a significant benefit in those first several sessions. However, or maybe in addition, when it comes to characteristics that predict maximal or minimal benefit, this always comes down to their foundational physiology. If they are already quite sick and quite challenged and they're starting to do hyperbaric therapy, if they do have a benefit, it's unlikely, in my experience, if they're not doing other things to optimize their health, that they're going to have a sustainable benefit after they finish hyperbaric therapy. And this goes back to the nurse that I work with. Her name is Gail, that I work with at the hyperbaric facility in San Francisco in 2013. I saw her initially go through and then have these relapses until she started having a better approach and found a better doc to work with to optimize her physiology so that she had a much better experience doing hyperbaric therapy. And then at the end, she had much more of a sustainable benefit. In the beginning, she would have such a challenge that she needed to be wheeled into the hyperbaric facility in a wheelchair. And because she was so having such a challenge with the fatigue and the brain fog and things like that because of doing hyperbaric therapy and how it was making her feel worse. And so what I tell patients all the time is that if you have a long-term condition or you have a long-term goal, even if you want to, work on longevity and healthspan, you need to be about 70% better before hyperbaric therapy is going to sustainably help you long-term. And that 70% is not where a lot of people are right now. And so somebody comes to see me and they have an autoimmune condition or they have a long-term issue with cognitive impairment or something, and they want to use hyperbaric therapy right away. I often tell them, no, it's not the right time, because if you want to have that long-term benefit, you need to be about 70% improved already. 50 to 70% is kind of my marker for most people.
So many people explain HBOT primarily through improved oxygen delivery, while others emphasize mitochondrial signaling and neuroplasticity. What mechanism do you think is most important in chronic neurological disease specifically?
When it comes to neurologic disease, I think that the most important piece here is the physiology at its base, which is that chronic neurologic disease is chronic inflammation. It's chronic mitochondrial stress. And so what hyperbaric therapy can truly do here is rebuild the architecture of the brain from the blood vessels to the cells themselves and to inside the cells themselves. It does this in a beautiful synergy of creating that scaffolding, as I mentioned before. And there's some beautiful studies looking at hyperbaric therapy at time 0, so before you start, and then hyperbaric therapy 40 treatments later, and how the brain just lights up with new blood vessels that are rebuilt in the brain. If you have better blood flow in the brain, you have better neurologic function in the brain. If you have better blood flow in the brain, you have less inflammation, you have better detoxification, all of those things. And so in my experience over the years, neurologic conditions are extremely sensitive to using hyperbaric therapy as a benefit, again, as long as that the foundation is also being addressed at the same time. And it becomes this ecosystem too, where if you start getting the brain more blood flow, more capacity, the mitochondria working better, then other technologies are going to work better too. For example, something like neurofeedback, right? Neurofeedback is going to help train the brain to think better and to optimize cognitive function. You can use other things like red lights as well and other synergistic therapies to help improve blood flow to the brain as well. And I know you've had some other guests talk about this too. And you can combine hyperbaric oxygen therapy with red light exposure and optimize the capacity to make more energy and better blood flow. And that's where I see really the hyperbaric field needing to go, is in this more integrative approach, using other tools, other technologies, supplementation, etc., to really create this way for brains not only to get all that oxygen and get that blood flow and create better mitochondrial function, but then leverage it.
So the hyperoxic-hypoxic paradox has become a central explanation for HBOT-induced adaptation. And Curious what your thoughts are as far as aspects of that model that are strongly supported versus which aspects remain theoretical.
So the hyperoxic-hypoxic paradox is the idea that when you're in a hyperbaric chamber, what we typically do at deeper pressures, we've been doing this since sort of the beginning of hyperbaric treatment, is that when you're at a deep pressure and you're under a lot of oxygen, what can happen is that can cause a lot of reactive oxygen species that we talked about earlier. And if you get a huge amount of ROS, this can sometimes cause seizures. And our colleague, Dom D'Agostino, is actually famous for doing the research at the Office of Naval Research, looking at ways to mitigate seizures in Navy SEALs that are at pressure because they're underwater and they have to be at 100% oxygen so they're not bringing any bubbles to the surface, right? And so what happens with a lot of oxygen can induce a seizure, okay? And there's also other areas of oxygen toxicity that are important, but oxygen-induced seizures is probably the most important. And so what an air brake is, or an oxygen brake, is that you're breathing, let's say, around 100% oxygen in a chamber, and every 20 minutes or so, instead of breathing 100% oxygen, you go back to breathing what's sea level oxygen. So from about 100%, depending on the chamber, to 21%. And this delta, this change, is protective for the brain because it's a break from the reactive oxygen stress. But there's also some really interesting physiology here where that delta, that change going back to sea level, your physiology actually thinks of that or sees that or feels that or senses that really as a shift into a relative hypoxia. Because you went from a hyperoxic exposure to a normal oxic exposure, but that the body sees that as a relative hypoxia. And as a result of that, that relative hypoxia releases a whole bunch of things in our body, and especially something called hypoxic inducible factor, Heath, which I'm sure your listeners know about, that stimulates a whole bunch of things to happen. Mitochondrial biogenesis, so new mitochondria, new blood vessels, decreased inflammation. And so that is where the power of the air brake, the oxygen brake, is, not only in protecting from oxygen-induced seizures, but there's significant potential and literature here talking about that hypoxic stimulus, that relative hypoxic stimulus, is causing this shift in physiology. So it's actually helping our patients get better faster when they have those oxygen breaks.
If you could only measure 3 variables before and after hyperbaric oxygen therapy, what would they be?
When I'm thinking about the best way to measure variables for patients, what I really want to know is what they're coming in for, why they're here with me. And that's usually going to give me the best understanding of what those markers are going to be. However, that being said, metabolomic testing has become the foundation to my clinical practice. Metabolomic testing is the idea of testing small molecules that are involved in metabolism, the real-time working of your cells. And what's cool about metabolomics, it gives you a window on what's happening now and what just happened, especially in energy metabolism. And so if I had a crystal ball and I could make a wish, every single patient that ever did hyperbaric therapy, maybe every single patient in the world, to be honest, I'm going to go that big, should be thinking about metabolomic testing, because this is the true foundation of our physiology. If you're looking at your genes, it just tells you, your genome, for example, tells you what might happen. Then you have your proteome, you have your transcriptome in the reverse order. So you have your genome, you have your transcriptome, you have your proteome, and you have your metabolome. And that's really where the metabolome is the first level after your DNA, where you get the real-time mechanics of what's happening in your cells. It also is a specific indicator of what's happening in your environment as well. Your toxin exposure, your light exposure, your stress, and things like that. You can see it at that level. And so testing metabolomics has been transformative to my clinical practice because now I can optimize vitamins, minerals, nutrients, antioxidant status, look at fatty acid levels, look at heavy metals even on the metabolomic level, and see what's happening and make sure that I can optimize that machinery before somebody even steps foot into a hyperbaric chamber. And so metabolomics is probably the primary thing. When it comes to other markers, it depends on the person. If they're coming in with a brain injury, if we can get imaging before and after, that is obviously awesome. If it's somebody that's coming in with significant amounts of stress and maybe they've had chronic pain or something like that, maybe you want to look at something like inflammatory markers, for example, which can be really, really helpful. So in the end, the tools and technologies that I use to surveil people really depend on the person, except that in the best case scenario, I'm really looking at optimizing metabolomic levels. And then, of course, their diet and their lifestyle. Like, these are huge things that I really try to do before somebody ever steps foot into a chamber. But those are not as objective, of course.
I imagine a seahorse assay for mitochondrial function could be interesting as well.
Oh, 100%. If we can actually look at mitochondrial function directly, which is now starting to happen, as you know, Ken. Like this is transforming clinical practice just in general. I think mitochondrial medicine is the future of medicine for now. I mean, it's the next wave of things for sure. And I have a lot of respect for Dom and Dawn as well, who've kind of brought this to the world via the ketogenic diet and looking at how the ketogenic diet can optimize mitochondrial function. And in my world, mitochondrial medicine, mitochondrial focus is kind of is what I do on a regular basis. And so if you can test this more significantly and better, which is starting to happen, it's extremely exciting at what we can do. The only translation of that is, well, how can we actually see this work in clinical practice? And that's really what I've been trying to do, even outside of the hyperbaric field. And it's very exciting what we're seeing.
In general, IHMC is very interested in mitochondria research and has been for a while, but in recent years, we've developed a very nice lab for that, and that's opened to lots of interesting avenues for research.
I'm excited to come down and see it one day. I've heard you talk about it before.
It's quite nice. What do you see as the single most important unanswered question in hyperbaric oxygen therapy today?
It has become the Wild West in hyperbaric therapy over the last 4 or 5 years. And that's because this technology works and the regulatory environment is still not clear. So I think one of the most unanswered questions here is that aspect, because you have chambers coming from all over the world that are going into people's clinics and people's homes. You have chambers that are going to very deep pressures in people's houses. You have mild pressures. There's not a lot of standardization when it comes to all this. There is hospital-based hyperbaric therapy where I trained. There's medical facilities outside the hospital where I did my medical directorship. My father actually owns a bunch of hyperbaric facilities in the New York metropolitan area and Florida as well. You have these independent centers, you have home centers, you have home clinics, you have home chambers, you have all this variation. So I think the single most important question probably is, at least one of them is regulatory, as to how this all kind of fits in and how this all works. Because my concern here is that people are getting these chambers for their homes. They don't know how they're using them. I had a guy that I just spoke to a couple of days ago that has a mild chambers in his house that he's using 10 times per week. And he's been doing this for 6 months. And so that's not what I'd be recommending for most people. And so there's a lot of variation. And what I've been trying to do, at least on the educational side, with other colleagues as well, is let's bring this together in sort of one universal capacity to understand what hyperbaric therapy can do, talk about protocols, try to standardize things across. But it's hard because it's a very varied field. There's a lot of mom and pop shops out there that have hyperbaric chambers. And I don't have anything against that. But I think the biggest issue I see is just the variation in protocols across the field, the variation in regulatory understanding from state to state. But this is all going to change. I see this changing a lot because we have larger independent clinics that are starting to grow and become big enough to be able to have their own ecosystems. And so I do see this changing. And I think the other maybe big unanswered question that I find so important is that it's not just about the chamber, everybody, right? It's about what you're doing before, during, and after the chamber almost always. And then the unanswered question there is, well, how do we create more of an education around that? And that's really what I've been trying to do.
So in 2017, you met Dr. Ted Achacoso, who's the founder of Health Optimization Medicine. And it sounds like he had quite an impact on you. So it'd be great if you could share with listeners how he introduced you to a fundamentally different framework for understanding health. That would be really interesting for us to hear.
Dr. Ted, I met in 2017, and he's one of those guys that you meet and you never forget. He's a brilliant physician. He's been involved in many different fields. He was involved in AI back in the 1980s. He created the first map of what was known at the time as connectome, basically the idea of how the neural circuitry works in a worm at that time. And so he's very, very smart. And when I met him, he was just finished his own evolution. He had started off as an anti-aging physician, well, after being a neuroradiologist initially when finishing medical school at the age of like 18 or something like that. And when I met him, he'd been 10 years into his own clinical practice that he was calling health optimization medicine. And what he had done was shift the perspective from disease focus into health focus. And what was interesting for me is as I was talking to him, a lot of what he was talking to me about resonated with me as a kid growing up in my dad's office as a chiropractor's son. The idea of that you give the body what it needs and optimize health rather than focusing on treating disease specifically and focus on disease markers or focusing even on root causes of disease. And the idea was, let's create the first standard of care for health, not disease. And we also have, as you both know, we have lots of standards of care for cardiovascular disease, for stroke and things like that. But there's really no no standard of care for health. And so what Ted had developed in his framework called health optimization medicine was a way to focus on that, to focus on setting the disease aside for now, not that people don't have diseases and conditions, but focusing on optimizing foundational biomarkers. And this is where metabolomics became so prominent in my evolution, because he taught me how to interpret metabolomic testing from a health-focused lens. If you think about it, most of what we do in medicine is very much not that way, right? We don't look at optimal health markers. We look at disease markers. Even if you go to your doctor and you have a normal lab, that's a normal range, but is that an optimal range? Probably not, right? Especially if you're thinking about hormones. If you're in your 50s or 60s or older, your hormones are not optimized anymore unless you're on hormone replacement therapy. Your hormones are optimized when you're between 21 and 30 years of age. And so what Ted did is create a whole system where you can shift nutrient gut hormone networks back to optimal ranges between 21 and 30. And he did this using the science of what's called holobiontology. The holobiont, HOLOBIONT, is the idea is that the human is not just made up of human cells. We're made up of fungus, virus, we're made of bacteria. We're vastly outnumbered compared to what is around us and in us, as many of you know. And so if you can optimize the holoorganism, that is you, that is what's most important. And the best way to do that was using metabolomic testing, because it was the real-time measurements of what's happening right now in your cells and what just happened. And it gives you a sense of what's happening in the environment around you, and also genomically and everything from there as well. So it became a huge piece of my evolution, because it was at that point that I realized I'd been doing this integrative approach for hyperbaric therapy for many, many years. And I kept farming people out or sending people, referring them out to other practitioners to work on functional health and integrative health. Then I'm like, no, I need to be doing this myself. This is the foundation of everything that I need to do. And so in 2017, I was starting to get trained by Dr. Ted. And at that same time frame, we actually, at his behest, decided to make this into a nonprofit organization. So Health Optimization Medicine in Practice is a nonprofit that trains practitioners on how to optimize health with a 7-module certification for practitioners, licensed and non-licensed. And I'm trained in that practice as well.
So, Scott, circling back to our earlier discussion about bridging the gap between conventional and alternative medicine, you've now become part of a practice that's not afraid to tap into specialties and therapies that break from conventional medicine, which is fantastic. And just as an example, you sometimes integrate psychedelic therapy with hyperbaric oxygen therapy. So it'd be great if you could talk about the framework that you use, which combines hyperbaric oxygen therapy with psychedelic therapy. I know a lot of our listeners would be very interested in this.
For a long time, Dawn, I was afraid to talk about psychedelic therapy. I think many of us in this world were, because it was very much not something you spoke about. But this all changed about 5 or 6 years ago, as I think many of you know listening. And that's been fantastic, because we now there's a huge amount of research that's being done in the psychedelic world, especially for our veterans, that this can be a fantastic way to help the brain and the body heal. And this is what I initially started seeing, which is interesting. Back maybe 10 years ago, I started having some of the veterans that I was working with, traumatic brain injury, PTSD, going to do different types of psychedelics, psilocybin, ketamine, sometimes ayahuasca out down in Peru. And they had transformative experiences as they were doing hyperbaric therapy. I realized that these veterans that had done some of that work, they were getting better so much faster than all the other people that we were treating. And it became very evident to me that there was a huge impact on, obviously the psychology is a huge piece here, but the neurophysiology, the neuroplasticity, the neuroinflammation seemed to have significant impact when they were combining these therapies together. And so it became part of my larger understanding that when you're thinking about hyperbaric oxygen therapy, you have to think about an integrative approach. If you have somebody with severe PTSD and traumatic brain injury, these guys and gals, they're under sympathetic overdrive, meaning their system is always in fight or flight. I've had patients over the years that absolutely should have gotten better in hyperbaric therapy. They had a very defined issue, like let's say it's a brain injury. And then hyperbaric therapy should have helped them, but it didn't. And I would look back and go, you know what? It's because they were such in sympathetic overload that nothing that we did would stick. If you're contracted down in sympathetic, you cannot heal. Fight or flight is not the way we heal. It's the way we run away from a saber-toothed tiger. And I have a slightly funny story here. I gave myself a mild concussion back in maybe 2016, 2017, and I had a hyperbaric facility to go to, obviously, which I did. These particular chambers, they were nice chambers. They had TVs on the outside. And on the outside of the chamber, you could watch a movie. And so I put on what I thought would be a great movie to watch during a hyperbaric chamber session, John Wick 2. Not a good movie to watch during hyperbaric therapy because that movie just stresses you the hell out. And I realized very acutely at that time, this is why some of my patients don't heal, because I was shaking in the chamber because I was waiting for him to kill the next guy or not get killed, right? And this is what's happening to a lot of our patients just with healing in general, right? But especially in my lens in the hyperbaric chamber is that you are in fight or flight all the time, nothing's going to change there. And then using some of these psychedelic therapies has been able to shift these guys and gals out of that sympathetic dominance. Probably the most profound way to do it that I've seen under the right guidance, under the right safety, et cetera, et cetera. But using it in combination with something like hyperbaric therapy and psychological care, I think it is the future. It is not an easy road to get there, but I'm seeing this in places all over the world using these combinations. And what's cool about it is that I've seen transformations in much fewer hyperbaric sessions when people are doing these kinds of psychedelic therapies and integrative therapies in general. And the biggest piece I do think, honestly, is that sympathetic overdrive, getting out of it and getting more parasympathetic, because getting somebody more parasympathetic is going to allow them to heal.
Very interesting. And continuing on the theme of alternative therapies, you also sometimes incorporate methylene blue into your work with patients. We recently had Dr. Francisco Gonzalez Lima on the show in episode 191 to talk about his research into methylene blue and how it's been shown to improve cognitive function and energy production. In fact, he's been on 2 or 3 episodes. You're also a proponent of the benefits of methylene blue yourself. Can you share your thoughts on methylene blue and how you use it when you're working with a patient?
I'm a huge fan of Dr. Francisco Gonzalez Lima's work, and I learned about him through your podcast actually many years ago when he was first on. And so it was transformative during that time. I think it was around the 2020, 2021 timeframe. And that's when I started using methylene blue in clinical practice. The reason is because it is one of the best mitochondrial supports that we have on the planet. And it helps the mitochondria work now, not 3 weeks from now, not 3 months from now, but right now. And when you're working with patients, as I do, that have mitochondrial function, which, by the way, 94% of US adults have some element of mitochondrial dysfunction. Only 6% of US adults are metabolically healthy, which directly corresponds to their mitochondrial function. And it can take a while to optimize mitochondrial function. When I work using health optimization medicine in that framework, it could take me 3 months, 6 months or longer to do that and to really get them to a place where their mitochondria are really optimized, sometimes even longer than that. But what's nice about methylene blue is that if you have a good, clean source of it, that it works in the mitochondria both to compensate for energy production issues. So it can compensate for any complex dysfunction on the mitochondria on the electron transport chain, bypass them, donate electrons further down the chain, maintain electron flow, regenerate energy production. And at the same time, it works directly as an antioxidant, but mopping up free electrons, so directly working like an antioxidant as well. Our cells are like gasoline-powered cars. They work, and then we make ATP, which is our energy currency. We make about 150 pounds of ATP every single day. It's a huge amount of energy that we need. But we don't just make ATP. We make carbon dioxide, which goes to the plants. They make oxygen. That's the cycle, everybody. Remember from 9th and 10th grade. And we also make water. In addition, we also make those reactive oxygen species that I was talking about earlier. And that reactive oxygen species in small amounts is good because they're signaling molecules, but too many for too long can significantly deteriorate the whole system. And so what methylene blue can do is it more works like an electric powered vehicle. It brings in more energy into the system and it works directly as an antioxidant. So there's no waste at the end of it. And so in almost all of my protocols now, especially when I'm starting to work with patients, I get methylene blue on board because it is a fantastic way to jumpstart mitochondrial function, jumpstart energy. So if you have better mitochondrial function, where is that going to be manifested, right? Where do you have the most mitochondria per cell? It's actually your reproductive organs. It's your eggs and sperm that have the most. Eggs have the most of any cell in the body. But right after that, it's your brain and your heart, your liver, your musculoskeletal tissue. And so if you have better mitochondrial function, you're going to have better brain function. So less brain fog, less mental health issues. I've had people start taking methylene blue and their anxiety and depression go away. It's because they're working, the mitochondria are working better in the cells, and now the brain is working better. Better cardiac function, better detoxification, better capacity to have musculoskeletal performance. And so it's become the workhorse of my clinical practice. The key is to make sure that you get clean stuff because there's a lot of garbage out there on Amazon for people that are looking at it. And you have to make sure it's free of heavy metals or as close as possible because during the production process, it could be contaminated with things like lead, mercury, cadmium, and arsenic. Mm-hmm. And so it's not the only thing I use in clinical practice, but it's one of the initial things I use as I'm building the system up over time.
As you can imagine, I'm a long-term fan of methylene blue.
I know you are. And I think it's one of the most unsung compounds out there because look, it's shockingly blue. If you take methylene blue, your urine is going to turn blue when you take it. So surprise, you're taking methylene blue that day. There's funny stories about chemists doing this back in the lab and then putting it into cookies and not telling everybody to party and then everybody having blue urine afterwards. But the thing about methylene blue, it's been around such a long time, and Francisco did such a great job talking about it for people that want to go back to those podcasts. But in essence, it's used in the laboratory as a way to medical mark things, including concentrating in the mitochondria. And Francisco's done some great work looking at how you can increase your energetic capacity by up to 70% in your mitochondria using methylene blue on its own. Is it a solution over the long term? I don't think so on its own. You have to build up the system, stop having people drink alcohol, get better sleep, optimize their stress response. But all of those things take time. And sometimes it's hard to get people going, I found in clinical practice. So if you can kind of address some of those bottlenecks very quickly, very efficiently using methylene blue, I've seen dramatic things change in patients' trajectory.
It's always fun if somebody goes to someplace like Quest and they ask for a urine sample and you hand her a blue urine sample and say, I'm not feeling well. The phlebotomist looks stunned and worried.
Very much so. And then I get this question all the time. Will it come positive on a drug test or something like that? Because we have a lot of athletes that use methylene blue now. We have a lot of athletes use it because what methylene blue can do, not only does it help with optimizing mitochondrial electron flow if there's dysfunction, but it can also improve endurance because it can work as the primary final electron acceptor if there's not as much oxygen around. And so it looks like it can improve aerobic capacity. The research here is early, but I've seen this. I work with a guy that did the Leadville 100, the ultramarathon here in Colorado, and he cut 3 hours off of his time using methylene blue, 36 milligrams every 4 hours or so. And I've seen this with cyclists that are using it and not telling their teammates or other competitors that they're using it too. It is okay to use in athletic performance, but if you're getting P-tested, your urine, as you said, Ken, is going to turn blue and it's going to mess up some of the other analytes in there. So you have to wait for the urine to, wash out and then they can test your urine and it'll come out clean, either way. So you can use methylene blue for performance is the short story.
So Scott, to find out more about your practice and services, where can people go?
If you're interested in learning more about me, the primary place, I have a website, my name, Dr. Scott Sherr, DrScottSherr.com. There you'll find work on my hyperbaric practice, my hyperbaric consulting practice that I've had in place now virtually for almost a decade. There you'll also find links to my health optimization medicine practice, which is the foundation of what I do. That's the foundational approach using metabolomic testing and others. So you can check it out there. I also have links there to some of my companies that I help run now that have been built from my integrative practice or in collaboration with others. So we have a nonprofit organization, as I mentioned earlier, called Health Optimization Medicine and Practice. It goes by Home Hope, and that's homehope.org. If you're a practitioner that you're interested in optimizing health rather than focusing on disease and looking at foundational biomarkers, I really encourage you to take a look at it. We have a 7-module certification. The modules include metabolomics, others like chronobiology, epigenetics, exposomics, which is the study of toxins, evolutionary medicine, the gut immune system, and others. You don't have to be licensed to take it, but you can learn how to optimize the health of your patients or clients. And that's what I do with my hyperbaric patients. And I also have just patients that I work on the health optimization medicine framework as well. So you can check that at homehope.org. I also have a company called Troscriptions. It's the letters TRO and scriptions like prescriptions, Troscriptions. And you can find us at troscriptions.com. And we have, I think, the best methylene blue on the market because we've tested it more than anybody else and we've been using it the longest. We have a product called Just Blue, which is pure methylene blue. We have another product called Blue Canatine, which is a combination of methylene blue with nicotine, caffeine, and CBD, which is great for focus. A little bit of nicotine doesn't hurt you as long as you don't vape it and smoke it, everybody. I promise. It's a great product. And so you can check that out at troscriptions.com. Tons of blogs on methylene blue as well. I've done tons of podcasts in addition, talking about the performance, the other aspects of how it can help, from a mitochondrial perspective. The final company would be a company called One Base Health. One Base Health is my company that started off as a hyperbaric technology company, but now has evolved into more of an ecosystem of connected technology and learning how to use this technology better. We also have hyperbaric chambers that have been developed using some new and cutting edge stuff as well.
Well, Scott, it sounds like you are unbelievably busy. and have your fingers in many interesting pots. Are there any new projects that are looming in your horizon, as if you need a new project? But are there any?
I don't need any new projects, Ken. Please don't put that out there. No, but the thing about the world that I live in is that everything's always evolving, right? And I think that as things evolve for me, everything kind of comes closer together rather than further apart. It used to be that I had a hyperbaric consulting practice, and then I learned about integrative medicine, then I learned about health optimization, then I learned about, and then we evolved health optimization medicine into the company Troscriptions to help people right now along that path. So for me, everything is actually, aside from my kids, I have 4 of those, and I don't know where half of them are half the time. That's still very difficult. And that's the other aspect of life. But from a business professional side, everything's become so much more sort of narrow focused, even though it sounds like a lot, because everything comes from my clinical practice, Ken. I still see patients every single week. I have my own virtual practice. It keeps me grounded here. I use all these tools and technologies on a regular basis. Hyperbaric therapy, methylene blue, our Troscriptions products as a suite. I use them. And so for me, it seems like a lot, but it's actually a lot less than it felt like earlier. So
it's a win.
It's good. Yeah.
So, Scott, we have 2 last questions for you. We're going to circle back around to the start of our interview. First, do you still play guitar? And then second, have you and the airport rocking chairs talked about a reunion?
I don't play guitar as much as I used to. I played a lot in medical school. I played a lot when my kids were young. I play intermittently now, but 2027 is my 20-year medical school reunion at the University of Maryland, which is just a year away from about now, actually. And so I'm excited to get the band back together when I'm back in town to do a couple of reunion gigs. If we can't do reunion gigs, at least we'll go to one of my friends' houses in the area and play some of our favorite tunes. We made original music at the time, and I would love to play some of that, as well as some fun covers that we used to do back in the day, too.
Love it. I think that sounds like a perfect plan. Well, Scott, it's been fantastic talking to you today. Thank you so much for joining us.
Thank you for having me, guys. This has been great.
Yes, thank you, Scott. It was good. Appreciate you coming on STEM Talk.
STEM Talk.
STEM Talk.
STEM Talk.
STEM Talk. STEM Talk.
So, Ken, on my way to work the other day, I passed a storefront that was promoting its hyperbaric oxygen chamber, which is just crazy. And that's something that you wouldn't see 20 years ago. As a longtime diver and researcher in the hyperbaric space, I'm quite familiar with hyperbaric oxygen therapy, but I never imagined we would reach a day when hyperbaric oxygen chambers would start popping up across the country and even in shopping strips.
Yeah, I know what you mean, Don. I've noticed exactly the same thing. Scott was insightful in medical school when he realized that hyperbaric oxygen therapy was being underutilized in conventional medicine. But as we discussed today, that is changing, and Scott is helping to lead the way.
So this is a fantastic discussion with Scott, and excited to see where his research goes forward. This is Don Carnegie signing off for now.
And this is Ken Ford saying goodbye until we meet again on STEM Talk.
Thank you for listening to STEM Talk. We want this podcast to be discovered by others, so please take a minute to go to iTunes to rate the podcast and perhaps even write a review. More information about this and other episodes can be found at our website, stemtalk.us. There, you can also find more information about the guests we interview.